Autism spectrum disorder is a neurodevelopmental disorder characterized by abnormalities of social development, abnormalities of communication, and restricted and repetitive behaviors, interests, and activities. Autism affects approximately 1% of children worldwide. It is much more common in boys than in girls, with a ratio of 6 to 1. Development of the affected children is abnormal since infancy and most cases present before the age of 5 years. Autism spectrum disorder has a strong genetic basis. Additional risk factors include the following: prematurity, birth defects such as cerebral palsy, maternal use of teratogenic drugs during pregnancy including sodium valproate, selective serotonin reuptake inhibitors, and exposure to various toxins such as pesticides, and immune dysfunction. Autism can also occur in a range of genetic disorders, including Fragile X syndrome, muscular dystrophies, neurofibromatosis, and tuberous sclerosis. As already mentioned, children with autism have 3 main categories of abnormalities. Abnormal social development. Here, the child is unable to form emotional relationships with people. For example, they usually don't respond to their parents' affectionate behavior by smiling or cuddling, and they dislike being picked up or kissed. In addition, they do not show interest in other children. A characteristic sign is gaze avoidance, that is, the absence of eye-to-eye contact. Abnormalities of communication. In autism, speech development may be delayed or the speech may never appear. Speech impairment is characterized by misuse of pronouns and inappropriate repeating of words spoken by other people, also called echolalia. These abnormalities occur as a manifestation of severe cognitive dysfunction. In addition, these children also have lack of imaginative or creative play, restricted and repetitive behaviors, interests, and activities. The term obsessive desire for sameness is used to describe this character of autism. For example, some children insist on eating the same food repeatedly, on wearing the same clothes, or on engaging in repetitive games. Some children are fascinated by spinning toys or objects. In addition to these 3 key features, children with autism may be irritable for no reason. They may also be overactive and have poor sleep. They soil or wet their clothes, and some may even cause serious injuries to themselves. About 25% of children will also develop seizures. Moreover, children with autism may have other comorbid psychiatric illnesses, including attention deficit hyperactivity disorder, eating disorders, and anxiety disorders. Management of autism starts with parental education regarding the condition of the child. Abnormal behavior can be managed with early intensive behavioral intervention. Identifying and treating other comorbid conditions is also important in the management. Unfortunately, no drugs are licensed to treat the core symptoms of autism spectrum disorder.